Um, okay, we're gonna go ahead and get started. Hello, everyone. Thank you so much for coming to our career talk today. This is our second career talk that is going to be hosted through the Cancer Leaders Like Us program, and we're super excited to have you all. There's lots in store. So if you are just joining on and didn't hear before, please, as I said, feel free to introduce yourself in the chat, name, pronouns, and current song on repeat.
Hi there.
All
Yeah,
right, Shai, if you
Rocio,
could
my
go
first
ahead
name
to.
Rocio, last name Torres, T as in tomato, Orres.
Okay, so yep, Shai, you can go ahead to the next slide. Okay, so our event today is Racial Healing and LGBTQ Health, a conversation with T. Benicio Gonzales, who I will introduce shortly. But welcome, everyone. It's so good to have you. You can go ahead to the next slide. We'll start off with some introductions, followed by a talk with T, and then we'll close out with some announcements that we have for the Cancer Leaders Like Us project and also the network at large. Okay, you can go ahead to the next slide. My name is Fela Burton. Most of you probably have seen me because I've been the one sending copious amounts of emails to everyone about this event today and also all of the communications for cancer leaders like us in general. So hello, it's super nice to meet you. Here supporting me today and also supporting like a ton with this entire program is Shai. So Shai, if you want to go ahead and introduce yourself, go ahead.
Hi, my name is Shai. I'm a project associate here at the network, and I work on the Cancer Leaders Like Us program. And yeah, it's great to see everyone.
Awesome. And then without further ado, I will also introduce T, who is our guest of honor today. T is currently working at the Center of Health Equity at the Louisville Department of Health and has been supporting the department with the strategic planning of deepening their focuses of the root causes of health through authentic community engagement, strategic partnerships, and addressing data gaps and challenges. So I will give T a chance to say hello. If you want to go ahead and take yourself off mute and just say hello to the people.
Sure. Hi, everyone. T, and I'm glad to be here with you today.
Yeah. Awesome. Okay, you could go ahead to the next slide, Shai. So before we get into the work that we're here to do today, we're going to learn and hear more from T for sure. So we're going to have a conversation with him. But I did want to introduce the network to those folks that this is your first time engaging with us. Welcome. But I did want to tell you guys a little bit more about what we do at the network and a little bit more about the Cancer Leaders Like Us project. So if you could go ahead to the next slide, that'd be great. So the National LGBTQ Network is really focused on three different things. One, educating communities about our increased risk of cancer and the importance of screenings, training and advocacy for healthcare providers so that they can be more welcoming to us, and then advocating for the LGBTQ community in mainstream organizations, media, and research. You can go to the next slide. Cancer Leaders Like Us is a very special program within the Cancer Network that I have the honor of leading. We just launched this program in October of 2020, so it is fairly new. Like I said, this is only our second career talk. And basically, the main focus of Cancer Leaders Like Us is to provide a space for professional development for emerging leaders, whether you're an undergrad, in graduate school, or consider yourself an early career professional. And we would like to support folks that are in the health field and specifically folks that are interested in careers in cancer specifically. And if you're not, we want to get you to a point where you are. So we do that through 4 different ways. One, we host career talks. You guys are here today, so you'll get a look of what that looks like, but we invite different kind of professionals from all different sorts of fields, whether that's doctors, researchers, policy experts, et cetera, so that you guys can get a feel for how it is that they came to the positions that they're in. We also do skill building. We offer leadership and development opportunities for members of the CLUE program, different networking opportunities. We want to bridge a connection between advanced professionals, colleagues, all of us that are doing this work, because there's not many of us, but we want to make sure that everyone is, connected and has the resources that they need. And then lastly, we do offer access to a wide range of resources, which I will tell you about a little bit after we finish up the conversation with T. But basically what that looks like is different internships, grant opportunities, scholarships, job opportunities, et cetera, to help advance you all in your careers and whatever it is that you want to do academically. So without further ado, we'll go into our conversation with T. I did just want to set some kind of not ground rules, but norms for this. So if you have any questions, please feel free. There will be a time for question and answer after the conversation. But if you have a burning question that just cannot wait, please feel free to enter it in the chat and we'll make sure to get to it in our question and answer section of everything. So awesome. Let's go into the discussion. I'm super excited. I've gotten a chance to talk with T prior to this, so I'm hoping to share all of the wonderful things that we've talked about with you all. But T, so my first question for you is, can you tell us a little bit about your journey and how you got to where you are now?
Yeah, so I have worked at the public health department, the local public health department, which is part of our local government here in Louisville for actually this past December was 12 years, which I'll be honest, I had really no intention for it to be this long. But, kind of before that, which because I never actually thought I'd actually work in public health, my background, my educational background is actually both my undergraduate and graduate degrees in social work. And so in my graduate education, really in kind of a policy concentration in social work. I think when I entered college, I thought maybe I would be doing some programming for nursing home residents, some active living kind of things and, keeping your mind engaged. I thought I would be doing those kinds of things. But in, my undergraduate education, pretty early on, I learned a little bit about social workers who were engaged in policy and advocacy and lobbying work. And it had never occurred to me that maybe social workers caring about the issues that we care about might be able to do that type of work. And so my mind had become set on that. And I've always had a focus really on, the effects of racism in our society. And so kind of wanted to focus on those issues. And so after grad school, I had some opportunities here in Louisville to do that type of work with a national organization who had an office for racial justice. And so I did some internship work. And then I was thinking about what I would do next. And some friends had told me that the public health department here had received a grant from the Kellogg Foundation to do some racial healing, racial equity work as a part of the public health department, which seemed a little bit curious to me at the time. It's much less curious to me now. I know exactly why we do that. But they said, you should apply to see about coordinating this grant for the city. And so I did that, and it was really eye-opening to me about the systems and policy issues that I had learned about as a social worker, and the real application in public health and where public health was going at that time and is still going today. The overlap that was there and the ability to apply kind of the systems kind of learning and social justice education that I had in my social work education and practice to the field of public health. And so I was fortunate enough to get that job. And I really thought that I would be with the department for, for just a couple of years to coordinate that grant. But that has turned into 12 years in a number of different positions. And at this point, being able to lead a really excellent team of colleagues who are able to kind of apply in much greater capacity now, because we're a much bigger team, some of these practices across our community. So that's a little bit about how I got to where I am today.
Awesome. Awesome. Yeah, I didn't realize that you had been there for over 10 years. That's amazing. So you've probably seen a lot of iterations of the department and the program that, you're working in.
Yeah, absolutely. I will say, I think probably this year or this past year, the Center for Health Equity. So the Center for Health Equity was established within our local public health department here in 2006 by Dr. Adewale Troutman, who passed this past year, but really a giant in the field of public health, who had the vision to establish this center, which was the first of its kind in the country to be part of the municipal government. And he really saw the need for working towards health equity through social justice. That was the vision. And that public health as a field really must concern itself with social justice issues if we are to really achieve that vision of health equity, where people have, a fair and just opportunity to be healthy in all of our communities. And so, the center itself is just, 16 years old, and I have been there for 12 of those years. So I have seen it through a number of different iterations under different leaders, both center directors and also health department directors. The practice of doing health equity in a local public health department, I think, has been and continues to evolve.
Awesome. Thanks so much for sharing that. I'm curious to know, what are some of the most pressing issues that you think that you've had to address while working in that role? And I mean, they could be issues that, we're facing today, or your community is facing today, or like in the past. Like what has kind of been something that has stuck out most to you?
Yeah, I think, I think one of the things that that I will say is that what I try to stress to people, both when sometimes I have people ask me, oh, well, should I come? Like, should I apply for this position at the center, or they want to do work in health equity? I think the most important thing that I take away as I kind of reflect on what the past 12 years have been is to understand that this is very long-term kind of work. It's day in and day out work. So, and unfortunately, I think maybe if you have any connection to social justice movements or anything like that, and in similar form, sometimes we work very long years in order to get to some wins, right? So some days there are wins, and those give us hope for kind of moving forward. But I will say that it's day in and day out work, and that relates to, what you're asking here about what are some of the big challenges. So I will say that over the years, I have seen what is the challenge for us as a community to help people understand what it is we mean by health equity. And I think that challenge continues today. When we're talking about health equity, we're talking at a population level, people having fair and just opportunities to be healthy. And this really, in our society, means addressing and understanding the ways that systems really create, for some of our communities, especially Black communities and other communities of color, create significant barriers to good health, create a threat to good health, And that for other communities, often white communities, creating really significant boosts and benefits for those communities to be able to really thrive more so, right? That is the complexity of how that happens, of how, say, an issue like transportation or education in your community or housing, how that has a direct, how that has its impact on health, and even can have relationship to health outcomes like cancer, is challenging sometimes for people to accept. And I think sometimes that's the science of it, right? Of like, hey, here's the research of how that happens. But also that it's hard to, because of then, as soon as we explain how that happens, if we are all can agree that we want to have healthier communities, then what are the solutions that we must entertain? And what are the solutions that we must fund? And how are we going to fund those solutions? This becomes very challenging. And this is I have a past colleague who he said, public health sits right at the middle of science and political will, right? So what is it that we're willing to do in order to move our communities forward, to really have it to where across our entire community here in Louisville or wherever you are, that people really have fairness and justice in being able to achieve their highest level of health possible. That political component is very challenging. And I think it must be said, in our society today, the science component is not met without a lot of significant challenge as well. We have a lot of misinformation in our society today about what is science, the role of science, and whether or not that should inform anything that we do. So from a public health perspective, we're really at a tough moment, not just from the political component, but from the science component and how that gets politicized in ways that are particularly harmful to our communities at this time.
Yeah, no, that you just hit so many gems, and thank you for naming all of those. And now I'm curious, because when you're saying that, it brought up to me like how public health is such a field that requires interdisciplinary work. Like it requires the policymakers to have relationships to researchers. It requires community workers to have relationships with researchers so that there is community-based participatory research and it's being done in an ethical way that also doesn't take from communities but serves them as well. So I'm interested to hear about like some of the intersectional approaches that you all have taken at the center, and how that has helped to overcome the challenges that you just mentioned.
Yeah, I think, if I would, for me, when I've been asking, okay, so what's the biggest challenge for me in terms of health equity today? Some of that has to do with the role of organizations and the jurisdiction that they have. So when we're talking about health equity, what we are talking about is whatever you want to call them: social determinants of health, root causes of health, and systems of power for us, right? So we're talking again about education and health and human services and housing and education, all of these components, right? Well, from a local health department perspective, we do not have jurisdiction over the local school system here, right? We do not have jurisdiction over the public transportation system, right? It's kind of a quasi-governmental agency to Louisville Metro government here, but we don't have we can't tell them exactly how they ought to operate in to advance equity in our community, right? So this is the real challenge for us. And therefore, as public health professionals, a significant part of our role then is how are we creating relationship? How do we create quality strategic partnerships to others who are in those particular fields, right? In order to come together, to share research, to share data, to share policy initiatives and ideas, and to support those policy initiatives and ideas in order to try to move this work forward. We actually, the entire vision of health equity really is reliant upon everyone being engaged in that work to a great degree, right? So our role at this time is really about trying to build those partnerships, using our network and connection, and then using the skill set that we do have, right? So the skills that we bring to the table around policy development and implementation, helping to do that, the data analysis work. As a public health department, we have access to certain data, health data that other institutions in our community do not have access to, right? So how do we contribute to the effort by utilizing the data that we have? And then trying to transform our government practice through community engagement work and strategic partnerships, not just within the health department, right? But because we're part of a larger local government system, helping others to do that as well so that we can move this work forward. Because otherwise, we will be left as a public health practitioners who maybe have a lot of good ideas about how the world ought to work, but without the authority or jurisdiction to make that happen. So the entirety of the work really hinges upon our ability to develop and maintain those partnerships and to try to have influence in those spaces.
I did want to also ask you about, I think you have a wonderful approach to addressing health equity and through racial healing. And I don't know if that's a concept that a lot of people are familiar with. So I would love for you to share a little bit more about, what that means to you personally, and then also within the work that you do.
Yeah, one of the things I reflect on is I'm not sure, I think probably my own family background has led me to a place of prioritizing the need for racial justice and racial healing. I tell people, I have two Mexican-American parents who divorced while I was a young person. And, one of them then being married to a person who's white, and another parent to somebody who's Black. And so I kind of had this interesting kind of dynamic kind of growing up where I was recognizing the challenges that happen when you have family of different racial makeup, and what that means in the world and what it means to other people, and the different experiences that people have, both in their present life and their families' histories. So I think that probably influences some of my passion for working towards racial justice. I think what I found in public health was, thankfully, gratitude for the scholars who kind of doing that work of understanding the ways in which racism and white supremacy really erode the possibilities of full health and full quality of life in our society. And that we are able to be able to say that actually working towards eradicating racism and white supremacy is very much about the work of being healthy as a community, and that public health practitioners and others who care about the health of our communities ought to be about that work. I will say, when I first came to work at the center, again, I was, so we had received this grant. We're going to focus on racial equity, racial healing. But I remember asking, said, okay, so what's the definition that Louisville Metro government utilizes for what is racism, right? That there was no such no definitions have been approved, right? So none of it. So we're kind of left in this place of like, okay, well, I guess we are in a place where we have acknowledged, somebody here in this government has acknowledged that racism is impacting health, but what are we going to do about that? And there have been so many efforts, and it is really challenging to get not just those in the public health department, but then also those across government, in order to be able to even talk about this. Thank goodness there are organizations like the Government Alliance on Race and Equity, GARE, and doing their work. We partnered with them and were able to do some kind of advancing racial equity training across Louisville Metro government. I will say, as the lead trainer in that effort, it's very challenging to, and I would say even probably anxiety producing some days when I was doing that work, because you're receiving lots of questions that you understand there's some animosity behind those questions, directly from people that are your colleagues, right? So then otherwise I need to go back and be just colleagues with these people across agencies. And then sometimes outright hostility about trying to take on this work inside local government. And there was resentment and like I said, outright hostility. Some days I had to say, okay, I need a break today because it's too much. So again, though, I think, but that has to be faced, right? If we can't face it, if we cannot bring it forward, then really what we are saying is that we will not, that we're capping what our progress will be, that there will be a limit to that. And the very hard part about that is understanding that there are some, maybe even many, who are okay with the cap on that progress. And this is the challenge, I think, for any of us in whatever organizations or large institutions that we might find ourselves in. I remember Dr. Troutman, in one of his writings, said, the very work of the center, and therefore like the work of health equity, is really about challenging the status quo. And so we should expect that there will be resistance from those who would rather that status quo not be challenged. And I think that's, for me, getting back to that point of, if you take on this work, then it's the recognition that I'm going to do this day in and day out. And I'm just trying to chip away and also try to find hope that there are many others, and I hope many more every day, who are trying to also chip away at this thing. And that's kind of where I find hope, is that knowing that there are others who are very committed to doing some of the chipping away here, and just day in and day out practice. And I really see this as practice work. It's just, every day getting after it and trying to, and recognize that you come from a long history of people who are doing this. Thank God we are not the first ones, and we won't be the last ones. And I know that for sure too. So we keep going in that regard.
Yeah, that was very grounding, what you just said. And I have so many more questions, but I also want to be cognizant of time. I want to ask, so we do have, like I said, some students, emerging leaders here on the call. And so I did want to ask a question in terms of what has been the most significant impact on your leadership journey? Like, have you had any mentors, or are there any programs or um, communities that you've been a part of to kind of help you get to where you are professionally and also get you to the mindset that you have carrying through doing this work as well?
Yeah, like I said, I've been at the department for 12 years. I've had some significant changes in my life during that time. During my time here at the center, I have, I've gone through a transition. I'm a transgender person, and I I felt very I know that I was nervous, right? You would think, oh, well, you work at Center for Health Equity, it should be fine. But at the time, the city did not have any kind of policies about what happens when somebody transitions at the work. So, what transitions at work. And I guess, I guess my undertaking that meant that we have a policy now. Um, I, it was it was challenging. The reality is that I relied deeply on a community of people who are outside of my work environment in order to hold me up. And they continue to do that today. Um, uh, I think when you're kind of going through some of those changes in a professional sense, it can feel very vulnerable, right? Because maybe it's the passion that you're working, right? This is my work, it's my passion. I don't want anything to jeopardize that. And I feel strongly that any of us should be able to come to work and not have to just kind of put up with the mess of other people's opinions about who we are. I should be able to do that. But, so I rely heavily on that. And I do feel grateful for a couple of colleagues at work who were supportive to me in that time. And the other thing I'll say is, when I started at the center, a couple of questions, we produced a large health equity report. And one of the things I knew in there, I was like, there's not really any mention. We hadn't yet, we had produced a couple, and at some point I said, well, we haven't had any mention really of LGBT health in here. We also, and this is part of, I live in Louisville, Kentucky, and so historically it's just been very black and white here. So, myself as Mexican American, I said, well, there are other people who live in Louisville who are not, white or black, and what about them? And how do we talk, what's the data that we have available to talk about the health in those communities and what that looks like? So I'm grateful today that, through, I think through some of my own leadership and also the real kind of capacity building of having more staff to be able to work on these issues, that we can kind of bring that forward into the work that we produce, and be more explicit and collect more data and make more connections, like that community engagement and strategic partnerships into those communities than we just wouldn't have had before. And some of that I think is realized through our COVID-19 response. More recently, right, around monkeypox. And I think the benefit of those is that we get to a place where we can, it expands more broadly even into the other work, right? That's not even just like, kind of disease specific or whatnot, health outcome specific, right? But that expands, and that those connections make their way to more of the work that we're doing. But I will say, I have often felt like kind of right, like the only one. And probably it's true. If we're talking about uh, you know, queer Latinos working at at our public health department, I probably am the only one. And right. And I don't know when there might be another and certainly trans one, right? So it's I am the only one, but again, I kind of rely heavily on my community outside of here. The other thing I will say is I've been very fortunate in my support of my leadership by Black women in particular have been a safe space for me, and a space where the value of my leadership has been lifted up by them. And so I carry that with me, and I know that I really truly feel like I wouldn't be able to be in the place that I am today without that real care and support. And it also means then I hope I'm trying to be a leader that is kind of lives out of that recognition, and is helping to make space for others to like build up their leadership. Because I do think that we have new and different ways to be leading that I think is exactly what in the broadest sense, the health field needs. And I know that we can kind of get there through supporting each other.
Yeah, thanks for that. Okay, and then I have one more question, and then I will open it up to other people. So if you all want to start putting your questions in the chat, please go ahead. My last question for you, and this is, I don't know if other people know this, T is also currently getting their PhD as well,
Right,
while
yeah.
doing all of this amazing work. So please tell us how that is going. And I think it's a reality. Like, a lot of us have to work through our academic endeavors, and yeah, how is that going for you?
Yeah, so I will say I started my program going doing part-time. I started my program in the fall of 2019. So I have been doing most of this program, through the pandemic and while working at a public health department. So, how is it going? It is really intense work. My focus is I am at the School of Public Health here at the University of Louisville, in health management and system sciences. So I have my focus is really around organizations. I'm really curious, as part of, not just my daily work, but just kind of research wise, like what is the role of health organizations in being able to advance racial equity, and is any of the strategies that we're taking on effective? I'm really curious, these are the things that I'm curious about. I will say similarly, just as in the support that I need to help me work, I rely heavily on a deep community to kind of help me stay focused in that work as a student. I'm really grateful that I have the opportunity to be learning all the things that I have and be gaining some new skills. But it is, I don't even know. Yeah, it's challenging to be able to try to do both, to try to maintain not a balance, because that I don't think exists, but to try to maintain some kind of life that is other than work and school. I would just say, if that's something that you're undertaking, trying to carve out at least something that isn't one of those two things, because I think it would be very hard for me at this point. I'm 41. I don't know that I could just be a full-time student at this point. I do need to work, but it's also very challenging to try to do both. So I would say, reliance on community, family, in order to be able to maintain some sense of yourself and why you were even doing either of these things to begin with, I think is really critical. And it's truly the only thing at this point that that's saving me, I think.
Yeah, thank you for sharing that, and also the realness, not sugarcoating what it is. Because
Yeah. No, I had people tell me, I did tell when I was considering beginning the PhD program, I had a number of people, it was really wild, people who do not even know each other, but gave the same message, which is, this is not about how smart you are. This is about whether or not you can finish. And to get finished is really about the support that you can get from others to just keep doing when, I'd rather be doing anything else.
Yeah, definitely. Thank you. That is going to end all of my questions. I could go on forever, but I will open it up. Thank you so much, Fee. I will open it up for other folks. Does anyone else have any questions? And you can feel free, if you feel comfortable coming off of camera or mute and saying what your question is, please go ahead and do that. This is a space for that. And if you feel more comfortable putting in the chat, we also welcome questions like that as well. So I'll give it a little moment to see if anyone has a question. And don't be shy. I think I see a hand raised. Isabel?
Hi there. Can you hear me okay?
Yeah.
Oh,
Yes.
perfect. First of all, thank you so much for this conversation today. There have been so many valuable insights here, so I really appreciate your time and willingness to share all this. I think one question I have, kind of looking at your experience, both in the public health world and as a researcher as well, is how you communicate your research to some of the communities who are impacted by the topics that you're studying. I've found it kind of tricky to both be leaning on the people you're trying to amplify the voices of in your work, and it's a tricky balance to strike. So I'm just wondering how you kind of conceptualize that in some of the work that you do.
Sure. So, I will say at the health department, we undertake things like health impact assessments, or, we have our community health improvement plans, or we have some different initiatives we undertook, during our COVID-19 response around vaccine uptake and things like that, but also kind of as a feedback loop for us in terms of there are lots of immediate demands, but then also a real learning for us as a public health department. Any other public health department would tell you the same, of some feedback from our community through some listening sessions, many listening sessions, to help us better understand about our COVID-19 response, about our efforts to have vaccine uptake, and then about what should the public health department be doing kind of in the future, right? So I would say for us, that's a critical component. There is, the literature reviews and all of that kind of work, but there's a heavy component in the tools that we use that is about directly engaging our residents. One, because that's who we serve, right? Like, this is their government. That's my, I try to remember that every single day at work, that this is their government. These are their dollars. So the work that we do ought to be about them. And then putting that into practice. I think for us, those pieces about how we're engaging them in order to craft and shape future work that the staff are doing on behalf of our residents, because all of it is on behalf of our residents, is really about trying to get closer to what is in fact equitable. I think this piece there about how close can we get to understanding and capturing the exact needs, but then also, to be honest, the really the solutions that our residents have lined out for us already, and oftentimes have outlined for us repetitively. Okay, it's not really a mystery sometimes. There continue to be very massive like social problems, and we'll continue, we're all continuing to try to work on those, but often our residents have already established a lot of what the solutions ought to be and could be. And our role is about highlighting those, and then also that part about how do we work in partnership across agencies in order to try to make these things happen. And it gets towards, from the perspective, and also like how we're publishing those things to make sure that we're being transparent about, in fact, what the community has said. That's a responsibility that I feel strongly that we have. This is what they have. These are the issues they have identified. These are solutions they've identified. Whether or not local government in the end chooses to work towards those, right? That's a choice. But I do feel like transparency and accountability means that we are honest about and publish what the community has put forth. That's at minimum a responsibility that we have in the work that we're doing.
Thank you so much.
Isabel, for your question. I think we have time for one more if anyone has one last question they'd like to ask. Okay, going once, going twice.
Oh, I had a question.
Oh,
Yeah, I wanted to ask you, like, for LGBTQ health specifically, what do you think is the most important strategic priority for achieving health equity?
Oh, this is a good one. So I'll say it's important to understand the context that I'm working in, right? I live and work in Kentucky, where we do not have, as of yet, statewide non-discrimination law on the books here. So I know for some of you, and I feel like I'm happy for you, maybe you live in a state where that protection, that non-discrimination law has been in existence, and maybe even for some time. Here in Kentucky, while we have some, I'm grateful to live in a city where there is that protection, but I'll say right now, in our court system here, there is a challenge to what we call our fairness ordinance here. And it's scary. So there's a challenge to that, and we're not sure under the current environment whether or not, or how that legal proceeding will end up, right? I want to be hopeful, but we also know that we are in a time where some of these things are challenging. I say this non-discrimination piece is important in the place where I am first, because we know that it means in things like housing and public accommodations and employment. I think that's important because while I know many of you, and I think it's great, are focused on cancer research or in this practitioner work, I from a health equity perspective and a population health perspective, we know that by addressing even any singular social determinant of health, we can actually have an impact on numerous health outcomes, right? So housing and the quality of your housing actually has an impact on, a wide range from asthma to cancer to so on and so forth, right? So that if we can make that environment quality and equitable, right, then we actually can have a really great impact on a lot of different health impacts, a lot of health outcomes in our community. Right now, without that protection here in our state, I feel like it holds back some possibilities that we have. In terms of for LGBT health and from a practice perspective, too, I'll also say that, sometimes it feels like we're living in two or maybe multiple different worlds, from where some of you may be residing to where we are here. Some of you probably are living in communities where there are LGBT clinics and very competent, no question about when you walk through the door, what's the competency and the capacity of the practitioners there in order to be able to meet your needs. That is not the case here in Kentucky. I'm very fortunate to have a primary care physician who's very knowledgeable, but there is not a place where somebody who's beginning kind of maybe their transition journey today, or somebody who's LGBT, who's like, hey, I just need a primary care physician who I know is going to treat me with dignity and respect. I know that going in the door. It's more challenging to find here in Kentucky. And I live in the largest city, in the state. So you're more likely to find it here. The real challenges for folks who are living out in rural or smaller cities in this state is significant and cannot be kind of understated there, that I think LGBT people are living in kind of many different worlds when it comes to health spaces in this country. And in Kentucky, we have a very long way to go.
Thank you.
That was a really great question. Okay, so we're going to close things out with, feel free to drop reflections, hellos, thank yous in the chat. But we're going to close things out really quickly with some announcements. If you want to go to the next slide, Shai. I think there might be one right before that. I'm hoping there is. Yes, there is. Okay, perfect. So like I said, if this is your first time being engaged with the network, welcome. We do have a few things that we wanted to let you know about. So we are hiring. If you're not looking, you probably know someone that is looking, and who wouldn't want to come work with us. We're great. No, just kidding. Not to toot our own horns, but we do have two amazing positions open. One is a data and evaluation manager that's going to be working with our N2S project. Applications are due at the end of February, and then a data management intern for the Cancer Leaders Like Us project. So I think, Shai graciously dropped the links to everything in the chat. We are also looking for volunteers. I think some of you submitted or entered into our contest that we had this past semester. If you're interested in being a reviewer, please email me and let me know by Friday. And then we are also looking for a group of student ambassadors and advisors for a student ambassador program. So if you're looking to gain or buff up some leadership experience, feel free to email me and express interest, and I will share more information with you. If you want to go to the next one, I like to honor time, so I'm going to speed through this as fast as I can. As I mentioned, we do have a database of different opportunities. We have scholarships, we have internships, we have fellowships, conferences, funding to go to conferences. If you are interested in seeing what any of those opportunities are, please go ahead and you can scan this QR code. Also, the link is in the chat. And or if you have any opportunities, for example, you are someone that is with another organization and you have an internship opening up or a job that is opening up, please share it with us. We are happy to put this on our database so that we can get it to as many people as possible. You want to go to the last slide, I believe. Awesome. And then if you haven't already completed a participant profile, basically this is how you officially become a member of Cancer Leaders Like Us. If you fill it out, we'd ask questions about like, what are your specific academic and professional interests so that we can match you with a mentor and give you catered resources that are tailored to you. So if you haven't filled that out already, please go ahead and do so. And then I think the last slide is like at the end. Yeah. Thank you so much for joining. Thank you, T, for joining us. I think we're gonna have 2 other career talks between now and May. So hopefully we see you there. If you have any questions that you didn't get to ask Steve, just feel free to send them to me and I can send them his way. But other than that, thank you everybody for coming. And I so appreciate you all taking the time out of your day to be present and hope to see you at the next one. Bye, everyone.